Hello, everyone. Our apologies for the delay. Thank you for joining us today for our virtual Open Enrollment Fair session. During today's session, we will go over medical benefits with UnitedHealthcare. Before we get started, I would like to brief everyone on a couple housekeeping items. All attendees are muted and will be muted throughout the presentation. If you have a question, please type it in the chat box located on the lower right of your monitor. All questions will be answered at the end of the presentation. Be informed that if you type a question in the chat box, everyone attending the session will not see your question or your name. However, if you have a question that is confidential, please contact the Benefits Division. Lastly, today's webinar is being recorded. A copy will be posted on the Benefits Open Enrollment website. At this time, I will turn it over to our presenters, Diana Burke and Margie Gorham.
Hi, thank you all so much for joining us. I'm going to just run through the agenda quickly. My name is Diana Burke. I am one of the account managers on the UnitedHealthcare side. Today, we are going to walk you through the UnitedHealthcare HMO product with a brief overview. We will go through the HMO guidelines, a benefit comparison snapshot, and then we'll run through some other products and services, some of which are actually new this year, that are all included in your benefits. And then after I conclude my portion of the presentation, I will be turning it over to Margie at UMR. So Margie, please go ahead and say hello.
Hi everyone, good afternoon. This is Margie Gorham, and as Diana mentioned, I am the account manager on the UMR side. Thanks, Diana.
You're welcome. So Margie will take you through the UMR portion of the presentation. She'll be reviewing the PPO products and overview, as well as a benefit comparison snapshot, and some other great resources for you. And then lastly, we'll turn it over to our Viva representative, Matt Ogden, to review some of the Viva services and do a brief Q&A. All right, let's go ahead and get started. Thank you again, everybody, for your time this afternoon. All right, so the Viva Performance HMO network builds upon stratifying the signature value, full network, based on the cost and quality of provider medical groups. Medical groups throughout Southern California are placed into tiered networks 1 and then network 2, using cost and quality metrics. Network 1 has the lowest cost and the highest quality of providers in network. So you'll notice on all 3 of our plan slides that I've included the network care costs on the left-hand side of your screen. I just think this is a really easy way to see kind of a snapshot of your benefits. So if you look to your left, you'll see that on this plan for Network 1, the copayment for a PCP visit is going to be $25. A specialist visit is going to be $25 as well, and so is an urgent care visit. A hospital visit per admit is going to be a $200 copayment, and an ER visit is going to be a $125 copayment. There is no deductible associated with this plan, nor coinsurance, and the out-of-pocket limit is $2,000 for self and $6,000 for family. Now, you'll need to select a primary care provider from the plan network because this is an HMO to help you manage your healthcare. Each enrolled person is going to need to select a primary care physician. Family members can be with different medical groups within Network 1. So, for example, the subscriber could sign up with Sharp and say their dependent is with Rady Children's. Not a problem at all. But it is important just to reiterate that this plan does operate as a traditional HMO, meaning that coverage is only available when you use a provider in the plan network. I did make sure to include a snapshot of the plan network on the right-hand side of your screen for San Diego County. And just so you know, a network is a group of healthcare providers and facilities that have a contract with UnitedHealthcare. So again, you'll see that full list on the right-hand side of your screen. But the big ones for this network are Sharp and Rady Children's. Because this is an HMO, there is no out-of-network coverage. So if you do choose to use an out-of-network provider, you will be responsible for the entire cost of the service. If you need to see a specialist, your PCP will need to submit an online referral, which you'll be able to view and confirm your referral on myuhd.com. And then lastly, preventative care is covered at 100% within our network. All right, so our signature value performance HMO network 2. So as aforementioned on the previous slide, our performance HMO network builds upon stratifying the signature full value network based on the cost and quality of our provider medical group. So this is going to be the second tier. So network 2 has the second lowest cost and the highest quality of providers in network. So again, you'll notice that network care cost section on this slide is going to be on the left-hand side of your screen. So just to give you a little idea of what your co-payments are, a PCP visit is going to be $30 on this plan. A specialist visit will be $40. An ER visit will be $200. An urgent care visit will be $30. And then lastly, a hospital per admit is going to be a $500 copayment. On this plan, because it is an HMO, there is no deductible nor a co-insurance. And the out-of-pocket limit for self on this plan is $5,000, and then for family, it's $10,000. So because this plan operates as a traditional HMO, you will need to select a primary care provider from the plan network, and each person on the plan must select a PCP. But again, the beauty of this is that you actually can, each enrolled person can have a different PCP associated with a different medical group. That's not a problem at all. You just must stay within that medical group. So for example, the subscriber could be with Scripps and their children could be with Rady Children's. That's not a problem with all. There's just no flip-flop being back and forth. Because this plan operates as a traditional HMO, coverage is only available when you use a provider within the plan network. And again, that list is going to be on the right-hand side of your screen for San Diego County. The big ones in this network are going to be Scripps and Rady Children's. So again, there's no out-of-network coverage with this HMO unless, of course, it's an emergency. So if you do use a provider out-of-network, you will be responsible for the entire cost of the service. And if you need to see a specialist, your PCP will need to submit an online referral for you. And then lastly, preventative care is covered at 100% within our network. All right, the CS Viva Alliance HMO is a distinct high-performing subnetwork offering an alternative lower-cost option for members. So again, you will see those network care costs on the left-hand side of your screen. PCP visit and an urgent care visit are going to be a $25 copayment. A specialist visit is going to be a $40 copayment. ER visit is going to be a $125 copayment, and then a hospital visit per admit is a $200 copayment. This plan, like the last two, there is no deductible nor a co-insurance associated with it, and the out-of-pocket limit for self is $2,000, and then for family is $6,000. You will see the medical groups in this network on the right-hand side of your screen, the full list, but the big ones for this network are UCSD, Scripps, and Rady Children's. And again, this plan operates like a traditional HMO, so you will need to select a primary care provider from the plan network. Coverage is only going to be available when you use a provider within that network, and again, those in-network providers are on the right-hand side of your screen. There's no out-of-network coverage, so you want to make sure that you are seeing a provider that is in-network. Otherwise, you will be responsible for the entire cost of the service. And then again, if you need to see a specialist, you just want to make sure that your PCP submits an online referral for you, which you can always view and confirm on myuhd.com. And then again, preventative care is covered at 100% within our network. So I know I just talked a lot about our HMO products, but I just wanted to do a quick overview and go through some of the requirements. So HMOs require the selection of a PCP. Members must select a PCP from one of the medical groups in the network of the plan they have enrolled in order to access care. For specialty care, referrals are required from your PCP. For the exceptions of things like OBGYNs and mental health visits. Once members have selected their plans, they're locked into that network, meaning that they must stay within that network for the full plan year. So that's when I was saying there's no flip-flop being back and forth between the medical groups. That was what I was referring to, unless, of course, there's a qualifying event. So marriage, birth, death, divorce, things of that nature, then there are, of course, special circumstances. Family members can choose different medical groups within their network. So let's say the family decides to sign up for the Alliance HMO, the plan we just reviewed. The subscriber could be with Scripps Clinic, and then the dependent could be with Rady Children's. That's not a problem at all. Members are able to change medical groups and PCPs throughout the plan year. However, medical group changes are going to be contingent on UHC's guidelines for medical group changes, whereas PCPs can be changed without limits. All right, So I do recognize that we just went through 3 similar plans. So I wanted to include this snapshot of just some of the costs and how they vary by plan, just to give you a better idea. So if you look, the top column on the left-hand side is the Performance HMO Network 1. The middle column is going to be Performance HMO 2, and then the CS Viva Alliance is going to be the third column. So we have those separated by your PCP co-payments, your specialist payment, your ER visit, urgent care, hospital, and then out-of-pocket limit. So if this is something that interests you and you have your phone, feel free to take it out and take a quick picture of this. It's always helpful to refer back to, I find. All right. Okay. So our maternity health solutions includes a real-time pregnancy app that helps deliver personalized content to determine risks and facilitate needed support and care during pregnancy. This app is designed to help members take multiple health assessments to determine risks, connect in real time with a nurse 24/7, share real-time data with nurses to support high-risk care, receive user access to health plan resources and information, stay informed about doctor appointments, receive customized messages and reminders to help drive decisions and promote dialogue with your doctors and care team, check pregnancy-related symptoms, track weight and milestones throughout pregnancy, access informative articles on pregnancy and postpartum topics, access personalized content for gestational diabetes, record the baby's development, create a birth plan to help with the baby's arrival. So a lot of really incredible resources here just through this app, and it's actually available for download from the App Store or Google Play, so you can access it pretty much anytime, any place. Virtual visits. This is one of my favorite programs that we offer. So registering for virtual visits is really easy. All you need to do is go through myuhd.com to register on your computer browser, or you can download any of the 4 apps, the Optum Virtual Care app, the Teledoc app, the Amwell app, or the Doctor on Demand. I just typically prefer going through my browser. All you need in order to sign up for a virtual visit is your insurance card and form of payment. You'll be asked a few questions about the reason for your visit and then placed in a virtual waiting room. There's actually no appointment necessary, and these visits are available 24/7, which is incredible. You're not forced to leave work for an appointment. You're not forced to drive in traffic again. You don't have to wait in any line, so it's a really great time saver. And you can actually schedule too an appointment in advance if you'd like to. That's not a problem at all. An average visit can last anywhere from 10 to 20 minutes, and if necessary, the doctor can actually prescribe you whatever prescription you may need and send it to the pharmacy nearest you. So again, it's a really, really great program. I do just like to point out that it is going to be a visit with a doctor from one of those contracted providers. Again, those 4 logos are on the right-hand side of our screen. It is not going to be with your PCP. So I always just like to make sure that our members are aware of that. So if for whatever reason you have a visit and then there is follow-up required, we just always ask that you let your PCP in on what's going on, just so they're fully aware. Behavioral health virtual visits. So this is a really incredible tool as well. Just like our medical virtual visits, we also now offer behavioral health virtual visits. Virtual therapy provides confidential support to help treat conditions such as AD and ADHD, addiction, depression, anxiety, and other mental health disorders. Virtual therapists here can diagnose, provide treatment plans, and prescribe medication if needed. I think it's really important to note that all of the behavioral health sessions are private. They're completely confidential and one-on-one with a licensed behavioral health therapist. And the beauty of this too is if you choose to have an ongoing visit with a provider that you really like, you can absolutely do that each time to maintain that continuity of care. So you can find a provider and schedule an appointment again through myuhd.com. And actually, I included some snapshots of what finding a provider on our search tool looks like. So if you take a peek at the right-hand side of this slide, you'll see 2 of those screenshots from the search tool on myuhd.com. And it's pretty amazing. You can search by zip code, care category, and care type to ensure that you find the right provider to meet your individual needs. UHC chiropractic care through Optum Health. So you have chiropractic benefits through Optum Health. To search for a provider, you need to visit the URL in the light blue below. I know it's a lengthy one, but it's www.myoptumhealthphysicalhealthofca.com. Once you go to that website, you will see the screen in front of you appear. You're going to want to make sure that on that left-hand side of your screen in that drop-down bar, you're going to select Provider Locator. Once you select Provider Locator, that'll actually take you to the screen on your right. You can fill out the information in the fields, and you'll just want to make sure that under the Plan and Product section, which I circled, that you put California Schools Viva, just so that you'll be able to find a contracted provider in your area. All right. So this is the new custom pre-member website for the County of San Diego employees specifically. We actually just created this year. We had one in the past that was it needed to be updated. So this is the new one. Feel free, again, if you have your phone out, to take a photo of this so that you have access to the URL. But the first thing I like to point out is that on the left-hand side of your screen, you'll be able to note the dedicated customer service number on the homepage that you can call at any point for guidance or assistance. It's incredibly useful, and I think it's always important to share that we actually have a dedicated customer service team specifically for Viva members. So they'll know exactly how to help you, what plans are offered. They can help you delve through your benefits and answer any questions, again, that you might have. On this site, you can view your plan options. You can find a provider or a hospital, an urgent care or an ER, and you can view your benefits. You also have access to all of your UnitedHealthcare resources, so our Rally Wellness Portal, our virtual visits, open enrollment materials, and more. From the homepage, you can easily access our Find Our Provider search tool, dependent on the network that you decide to sign up with, as well as in-network behavioral health providers, which I just reviewed. So you'll notice at the top of the screen in the navy banner, you can also learn more about plan options available as well as your plan benefits. All right, so pre-member site continued. So by clicking on the member benefits tab in the top of the blue banner on the homepage, you have access to materials, again, from Open Enrollment. So this PowerPoint will be uploaded. Plan documents, summary of benefits, etc. Member flyers for value-added programs and resources, and a plan comparison and pricing and benefits tool, which you'll see on the right-hand side of your screen. Again, I just think that this can be really helpful if you're not quite sure which plan to sign up for. All right. Myuhd.com. So I realized that I have shared a lot about myuhd.com, but kind of indirectly when it comes to our other programs and resources. So myuhd.com is our member portal. If you are already a member and you haven't signed up, I strongly encourage you do so, just because it is just the best portal there. You have so many resources available to you, and you can kind of really take your health into your own hands, which is always nice. All you need to register is just have your health insurance card handy, and then in the left-hand corner of your screen, you'll be able to create a profile. So on myuhd.com, you have the ability to actually change the language, which you can see in the top right-hand corner that I circled, to best meet your needs. And you can find a provider from our various search tools, whether it be a doctor, a pharmacy, a dentist, you name it. We have all of those search tools available. You too can view claims, view referrals, change your PCP, access our Rally portal, access virtual visits, print temporary ID cards, access spending accounts, access additional health resources, heart care, managing stress, emotional support, and so much more. It's a really great portal, so highly encourage you register if you haven't already. All right, so how to read your UHC ID card. So this is just an example of a County of San Diego ID card. So if you look on the top left, you'll see that that is your member ID number. Bottom left will be your primary care provider and your assigned medical group. Top right is your group and health plan number. And then bottom right typically includes your co-payments information. So I apologize. I know that this is a very small example, so I'm not sure how well you can see it, but hopefully you get the gist. And then on the bottom of your card is where your medical provider network is listed. All right, so this is the back of your ID card. So top left, you're going to have the number to call for customer service, as well as our website. Bottom left, you'll have your regional or secondary medical network. And then on the right-hand side, your number to call for mental health support. And then on the bottom would be your number to call for any claim questions. Understanding your explanation of benefits, or EOB. So I'm sure everybody has gotten one of these in the mail. It's typically a pretty thick envelope with a few pages, and it can be kind of scary sometimes. So that's why we wanted to make sure that we walk you through this. There's nothing to worry. This is just your explanation of benefits. So typically at the top, it will say, this is not a bill, do not pay. This is to notify you that we processed your claims, and that's really all it's sharing with you. So the top kind of middle of the screen, you'll see the number 1. That is where the member or patient information is listed. The member is going to be the name of the individual with the health coverage, and patient is going to be the name of the person who received the medical care. And then the number 2 is going to be the full claims summary. So this section summarizes how much the plan paid, any plan discounts applied, and then how much you may owe your provider for all of the claims included in the explanation of benefits. But again, this is not a bill. This is more so just a breakdown. All right, so continue. So this is the claim detail page. You'll see when you see number 3 that this is the service description. So it's going to be a description of the care that's provided. Remark code text is listed below the service details box. The section 4 in the middle is going to show you what your plan has paid. So the amount of benefits paid to the employee or the provider, okay, for these services. And then 5 is going to show the deductible, copay, coinsurance, and non-covered itemized responsibility. So this is going to show the amount owed to the actual provider for services. And then 6 is going to be the notes section, which gives you more detail on how the claims were processed, and it also shows you how to appeal and what your appeal options are. All right, and then lastly, number 7, this is your account summary. So it's going to show the year-to-date deductible and the max amount for you and your covered dependents. And then 8 is going to be the definitions of key terms. So definitions, this section defines the key terms used to explain your claims. All right, and that is actually all for the UnitedHealthcare portion of the presentation. I am now going to hand it over to Margie from UMR.
Thank you, Diana. So welcome to your 2022 open enrollment, and thank you for taking the time to learn about the benefits offered by your employer through UMR and UnitedHealthcare. My name is Margie Gorham, and I am the UMR Field Account Manager. So we will spend some time reviewing some of the tools and resources available to you, as well as your medical benefits for the upcoming year. I will be sharing quite a bit of information regarding your medical benefit offerings, provider search website, and many other resources. So who is UMR? We are a third-party benefits administrator. We are the TPA that provides employers and health benefit plan members with services to help you get the most from your benefit plan. UMR will assist in managing the benefit plans on behalf of California Schools Viva, County of San Diego. Our main goal is to provide you and your families with timely, accurate, and caring services. This includes medical claims processing. We also help coordinate care if you are in the hospital or dealing with a chronic health condition. It's important to understand your healthcare benefit plan so you can make the best healthcare decision for you and your family. So in the next few slides, I will also talk about your PPO and your qualified high deductible health plan benefit coverage with HSA. Also how to select your provider and many other resources that will give you the tools in getting the most out of your plan. With UMR, your medical benefits give you access to the UnitedHealthcare Select Plus network. Next, please. So your employer has given you access to the PPO network through UMR. So what is the PPO network? These providers are contracted with UnitedHealthcare, and they are a group of doctors, hospitals, and other healthcare providers who offer network discounts on services they provide. A great benefit to you if you go to an in-network provider is cost savings. So when you receive care from an in-network provider, the plan typically pays a bigger share of the cost and you'll pay less out of pocket. Another benefit is your ability to self-refer to providers. This is the freedom of choice that you have. If you're enrolled in the PPO plan, you have the flexibility to switch to a different primary care physician anytime. You can also see a specialist without a referral. This could be a dermatologist, gynecologist, infectious disease doctors, and many others. You're free to visit any provider you choose. Your preventive services are covered at 100% by the plan, so there's zero cost for you. We do highly recommend going to an in-network provider, especially if you're going for your preventive services, because if you go to an if you go to an out-of-network provider, your services are not going to be covered at 100%. The reason for that is that our in-network providers are held to a contract and out-of-network providers are not and can charge you what they see fit. Next, please. So you have two benefit options with UMR. You have a PPO plan and a high deductible health plan. Both plans are with United Health Select Plus Network. So a couple of things to keep in mind. Preventive care is covered at 100%. These are your annual screenings, regular checkups, well-woman exam, routine vaccinations, well-child visits, as long as it's an in-network provider. It will be paid at 100%. You also have an out-of-network coverage, but it is always best to utilize the in-network coverage whenever possible. You don't need to choose a primary care provider or get referrals to see a specialist, but we do suggest you consider having a PCP. They can be helpful in managing your care. So for your PPO plan benefits, you have a deductible. You have to meet your deductible before you pay your coinsurance or a copayment for medical services. So for an individual, the deductible is $300, and for a family, that will be $600. The most that you will pay out of pocket for an individual is $2,300, and for a family, that will be $4,600. Your coinsurance for medical expenses, the plan pays 80%, and your coinsurance will be 20%. This is for the in-network providers. Your copayment for a primary care visit is $20, and for a specialist, your copayment is $40. Keep in mind that your pharmacy vendor is with Express Scripts. The second benefit offering is your qualified high deductible health plan that will be paired with a health savings account. So when you enroll in this plan, a great advantage to you is cost savings and tax benefits on your medical expenses through the health savings account. By using pre-tax dollars in an HSA, you can pay your deductibles, co-payments, coinsurance, and other qualified expenses, which can lower your overall healthcare cost. A few things to keep in mind is you have an out-of-network coverage, but it's, as I said earlier, it's always best to utilize the in-network coverage whenever possible. You also don't need to choose a PCP or get referrals to see a specialist, but we suggest you consider having one. They can be helpful in managing your care. Your preventive services are covered at 100% as long as it's in an in-network provider. Your plan benefits a deductible. You have to meet your deductible before you pay a copay or coinsurance. So for an individual, the deductible is $2,700, and for a family, that will be $3,000. The most that you will pay out of pocket for an individual is $3,000, and for a family, that will be $6,000. Your coinsurance for medical expenses, the plan pays 90%, and your coinsurance will be 10%. This is for in-network providers. Your copayment for a primary care physician, the plan pays 90%, and your coinsurance is 10%. This also goes to your specialist. The plan pays 90%, and your coinsurance is 10%. Please note that your pharmacy vendor for the high deductible health plan is with Optum Rx. Next, please. It's important to remember that you will have access to the umr.com website after you have been enrolled. After you receive your member ID card, make umr.com your first stop. You'll find everything you want to know and need as soon as you log in, such as viewing your benefits and claims, ordering, viewing or printing or fax an ID card. You can find a provider, check your account balances, access your pharmacy benefits. You can also visit the health center for tools and information, and you can get the answers anytime, 24 hours a day, 7 days a week. A few things to know that to help you through the registration process: make sure you have your UMR member ID card handy. You will need your member ID number. and CS Viva group number to enroll, dependent spouse must create their own online account by selecting I am the spouse or dependent when they register. You will also need to provide a valid email address and make sure you select a username and password you can remember for when you log in again in the future. Next, please. Also, when you are in the umr.com website, you will have access to the online provider directory after you have become a member. So to quickly find the care you need, simply select Find a Provider, and in the Provider Network tab, look for the Provider Network UnitedHealthcare Select Plus Network and start your search. Another way to look up a provider is by selecting the Find a Provider icon, and it will give you an option for a more specific search. So as a UMR member, you have the ability to search mental and behavioral health providers as well. This includes counseling and substance abuse by selecting the Behavioral Health Tile tab. This link will direct you to our Live and Work Well provider website. You can also call our UMR toll-free number at 1-800-826-9781 to assist you if you're having trouble finding a provider, or if you're checking if the provider that you have is in the UnitedHealthcare Select Plus network. And if you're also having a hard time navigating the site, our customer first representative are happy to help you in finding an in-network provider. So as you navigate through this provider search online directory, you can look up care where you live or work. You can also search specific to a city and state or distance by zip code. This tool can also help you search providers by categories such as specialty type, doctors and other healthcare providers, hospitals, clinics, urgent care, and imaging centers, laboratory and imaging to get your screenings and lab tests and scans. You can also search by services and treatment and care by condition. So some great things to look out for when searching for providers is with the UnitedHealthcare premium symbols. These are the heart icons that you will see next to the provider listing. So as you can see, 2 dark blue hearts rating are the premium care physicians. You will save the most money when seeing these providers, and we highly encourage that you see these providers whenever possible. Our premium care physicians are providers that have met our program criteria for quality and cost-efficient care. The next rating is the 1 dark blue heart and 1 white heart provider. This is the quality care physicians that has met the program criteria for providing quality care. The next rating is with the 2 white hearts, and these are the providers that the quality for service has not been evaluated, and it also means the specialty is not evaluated or their evaluation is still in progress. The 2 light gray hearts rating are providers that does not meet our quality of care. So what does this mean? UnitedHealthcare reviews and rate healthcare providers in the network for how well they deliver quality and cost-effective care. They also are rated by the feedback from our members. So whenever you see the premium care and quality care physician, you will save the most money and get the most quality and care provided. And it is very important that when you choose your physician to look out for these symbols whenever possible. Next, please. So another great feature is our treatment cost calculator tool. This tool can help you estimate your potential out-of-pocket costs for a treatment or procedure. You can predict your costs based on the plan you are enrolled in. So with the health cost estimator, you can search for treatment or procedure options in your area. You can compare costs based on the medical facility you visit and view a range of costs based on your medical plan. So this tool is beneficial for you to plan for how much out-of-pocket it will cost for a certain treatment or visit at a particular provider. And it is definitely one that you need to check once you become a member and have access to the website. Next, please. So with the health cost estimator, you can search for treatments or procedures from local providers, also view estimates, including your out-of-pocket costs and what your medical plan will pay. You can also choose a provider and get a final estimate. So as you can see in the slide, you need to look for the health cost estimator icon to get to the treatment cost calculator. This is such a great benefit as a UMR member to have a projected cost for certain treatments or surgeries so you can plan accordingly. So choosing a primary care provider is not mandatory for your plan. However, we do highly encourage that you choose a primary care physician. A PCP is a doctor you go to for most of your general healthcare needs. So when you have an established relationship with a PCP, there is a continuity of care. This is with your routine checkups, health screenings, immunizations, and they can also help manage your preventive care. So you can address also your health concerns with your PCP because they are aware of your overall health and can address them quickly. They can also help manage your prescription medications. So when you also have an established relationship with your PCP, you can ask them for advice and information on healthy behaviors, treatment options, and self-care. So even if the plan doesn't require the PCP's referral to a specialist, it's always a great idea to check with your primary care physician, and they can also recommend a specialist for you. So with the PPO plan comes freedom and flexibility. However, there are certain services that require prior authorization. So these are put in place to make sure they are medically necessary services. So if you are a dependent, plan to be admitted to the hospital or receive certain outpatient services, UMR may require prior authorization. Your provider may be asked to provide information to confirm the service or inpatient stay is medically necessary, clinically appropriate, and considered effective for treating your condition. So these services are hospitalizations with the exception of emergency services, inpatient surgeries, behavioral health stays, home health care, durable medical equipment. These are the CPAP machine, back brace, and wheelchairs, for example. Radiology services, such as the MRI, PET, and CT scans, chemotherapy and radiation, dialysis, transplants and transplant-related services, cosmetic procedures, and clinical trials. So as I said earlier, these are in place to safeguard that you're getting treatment that is absolutely necessary and medically needed. Next, please. So another benefit to you is our dedicated nurse line. A call to a UMR nurse line service will connect you to a team of registered nurses who can answer your questions and provide advice. Our nurses are standing by to help you any time of day, 7 days a week. We even have nurses available to chat live with you online at umr.com. So best of all, it's part of your health benefits, so there is no cost to you. Our nurses can answer your questions like what preventive screening you need, how can you learn about a new diagnosis, over-the-counter medication help, or should you go to an emergency room. Translation is also available to non-English speakers, and the nurse line phone number is listed on the screen. That's 877-950-5083. Another great feature is that you do have access to Teledoc. You can speak with a physician virtually through a video call 24 hours, 7 days a week at the convenience of your home. So you can speak with a physician if you're experiencing a sore throat, cold, flu, pink eye, rashes, and many others. There's a small copay to utilize Teledoc. You can also call for a second opinion. I do highly recommend that you create your profile through the teledoc.com website and register with your UMR ID member number. They're also able to see your prescription. So this feature is so helpful, especially at this time that we're unable to see a doctor physically due to the pandemic. So with Teledoc, you can talk to a doctor anytime and anywhere. You can receive quality care by a Teledoc healthcare doctor by connecting by phone, video, or mobile app. You'll be assisted in 10 minutes on average. A network of doctors can treat every member of your family. You can also have your prescription sent to the pharmacy of your choice, and you pay less than going to the ER or urgent care clinic. Next, please. Some of the health issues that I mentioned earlier, you can get consultations are cold, flu, allergies, strains and sprains, digestive issues, sinus problems, and pediatric care. So to access Teledoc, you will just need to your profile through the teledoc.com website and register with your UMR ID member number, or you can simply call the 800 Teledoc phone number that's listed on the screen. That's 1-800-835-2362. Next, please. So if you are a new member or have switched from UnitedHealthcare to UMR, you will receive a new member ID card. And on the front of your ID card, you will find your member ID number assigned specifically to you to track all of your benefits and claims information. Will also see a list of the family members covered under your plan. Your medical provider network, also referred to as your preferred provider PPO network. Going to doctors, clinics, and hospitals in your network will save you money. The number assigned to identify your group health plan and information about your prescription drug plan. Pharmacists use this to process your claims. So in the front of your card, you will see if you've enrolled in the PPO plan, you see Express Scripts logo on it. And if you're enrolled in the deductible health plan, you will see Optum RX logo on the front of your card. Next, please. So on the back of your card, you'll also find the UMR Care Management phone number to call when your plan requires prior authorization for certain medical services. If you're traveling outside your network coverage area, you can look to see if you have access to a regional or secondary network. The toll-free phone number is listed there to call when you have questions about your pharmacy benefits, and the phone numbers to call for UMR customer service or nurse line. Next, please. So we don't have an app, but we do have a mobile website. So all the tools you see today is available in your smartphone. With umr.com, you can log in and pull up a digital copy of your member ID card on your mobile device. You'll find all the same information as what appears on your card. Your doctor can also scan the on-screen barcode to get instant access to your benefits information. And you can also print or send a copy of your card to your doctor's office. Next. So what happens after you receive care? Anytime you or one of your dependents see a doctor, visit the emergency room, or admitted to the hospital, the healthcare provider or facility will submit a claim to UMR for processing based upon the information shown on your member ID card. UMR then determines how the claim will be paid based upon the rules outlined by your benefits plan. Next, please. So once you visit your provider, this is a diagram of how claims are processed with UMR. UMR will typically process your claim within 30 days of receiving it from your provider. We may contact you and ask for additional information to complete your claim. And if you have any questions regarding your claims or explanation of benefits that you're not seeing in the UMR website, you can always call the UMR phone number listed in your ID card, and we'll be happy to answer any questions you may have regarding your claims. Next, please. So after you receive any services from a provider, you will be receiving a bill or an explanation of benefits in the mail, and you will see the amount you're billed may depend on different things. These are the type of care you receive, a co-payment amount or co-insurance level for the service or services, the amount of money previously applied to your deductible, contracted discount for in-network care, out-of-pocket maximum amounts for your benefits. It's important to review your explanation of benefits whenever you receive them. Next, please. So after UMR has processed your claim, you'll receive an EOB or an explanation of benefits statement. This is not a bill, but it will tell you how much the services cost, how much of the cost will be paid by your benefits plan, how much you may owe, if anything, and what special codes mean. Please refer to your explanation of benefits to match the bill that you receive from your provider. It's very important to review and check the amounts. Next, please. So an explanation of benefits is simply the statement explaining your benefits activity, includes services provided, the amount billed, and amount paid. So here's an example of the EOB that you will be receiving in the mail, and you can also select electronic statement via the UMR web portal if you prefer not to get paper statements. Next, please. So utilizing the umr.com website gives you access to your EOB and view all your claims. This is the fastest and easiest way to check the status of your claims. So as you go through the portal, you'll be able to see your claims are clearly organized and easy to sort. You can find out how much you owe and what you owe and get all the details in one place. And most of all, it is safe and secure, and you don't have to worry about losing any paperwork since everything is in one place. Next, please. So another great feature in the website is when your ability to check your benefits and highlights of your plan, copayment and co-insurance for you and your dependents. You can also see the amount of your office visits. So you can get a review of your deductible and out-of-pocket amounts, and if you are close to reaching it. Next, please. Also, with the website, if you don't have a chance to call on the phone for questions that you may have, a great feature that you can use in the website is our live chat customer service. This is also available to you 24 hours, 7 days a week. Next, please. Please note that UMR may contact you and ask whether medical care you receive was related to an accident, and we process claims appropriately on your behalf. We may also contact you and ask for additional details related to accidents resulting in an injury. So for any questions related to accidents, you can also visit the umr.com website and select the accident details icon or call the 888-291-3774 phone number. Next. So as we mentioned earlier, UMR can assist and support coordination of care. We have nurse case managers if you've recently been diagnosed with complex conditions such as, and they can help with chemotherapy or cancer or major surgeries. UMR nurse case managers serves as advocates for patients and their caregivers during medical events involving multiple healthcare providers and procedures over an extended period. Our UMR nurse case managers can support you by reviewing your treatment needs with your doctor, help you and your family understand your benefit options from diagnosis to conclusion. They also coordinate care among different providers and communicate any complex issues to your medical plan. Next, please. We look forward to helping you, and if you have any questions, you can log in and visit our website at umr.com. It's fast, convenient way to get information and access services and resources provided with your benefit plan. And you can always call us at 1-800-826-9781. Thank you very much. Now I hand it back over to Diana or Matt.
Yes, good afternoon. Thank you so much, Margie. This is Matt Ogden with California Schools Viva. Can you guys hear me okay?
Yes, we can, loud and clear.
Yes, we can hear you, Matt.
Okay, just wanted to make sure. I had some technical difficulties, but thank you so much. Again, my name is Matt Ogden. I am with California Schools Viva. I am the dedicated account manager for the County of San Diego. And just to begin, I wanted to touch base real briefly on Express Scripts, that we are currently waiving medication copays if you are accessing hypertension or diabetes medication. We've noticed that they are the most common chronic illnesses in Viva, and together they account for almost 20% of our members. And so if you are accessing your generic hypertension drugs or oral hypoglycemic medications, as long as you go through the home delivery system, those medication copays will be waived. Next slide, please. So here are the medications. These are a sample of the medications that will be waived as long as you go through that home delivery through Express Scripts. Next slide. Now I would like to take and turn our attention to Viva's resources and the additional benefits that are available to you at no cost. Next slide. So supporting our members, we have a couple different resources that we can provide you with at no additional cost. Like I said before, there's our Viva Advocacy team, which helps members successfully navigate the quality issues in our healthcare system. I'm going to touch base a little bit more on this. And then we also offer on-site member services. This is going to be any well-being on-site services. We are also providing flu shots this year. So if you would like to set up a flu shot meeting on site, then we can go ahead and work with you on getting that taken care of and administered. Also, you can receive your flu shots as well through participating providers at no cost to you through pharmacies. Finally, I'd like to touch base on Teledoc medical experts. This is a second opinion program, and I'll go into this here in a little bit more detail. Next slide. So our Viva Advocacy department. Viva Advocacy is actually one of my favorite departments that I work with each and every day on member issues that they are having. What they are is they're a dedicated team that works in-house with Viva from 8 to 5 a.m. Monday through Friday. And if you have any questions about, let's say, a bill that you're receiving, you thought there was a covered service and you find out that it's not covered, you can reach out to our advocacy department. They can work with the carriers on the back end to see if that was supposed to be covered or not. They can help you with access to care, quality of care. If you're being denied coverage, they can work either with the medical groups or the carrier providers as well on the back end to help resolve whatever challenges or issues or questions that you have. They're absolutely fantastic at what they do. Anytime that you call them, it is 100% confidential as well. So I always like to bring up an example with this. I've had members who have literally been at their pharmacy trying to pick up their prescription, and it's showing up in the system that this is not a covered prescription. Well, they have reached out to our advocacy department, who is able to verify their coverage through their plan and see if that medication is a covered service. If it is, they've reached out to the pharmacy directly and let the pharmacist know about the members group number, and letting them know that yes, that prescription is covered and here is the copay or the cost of that medication. And I've had turnarounds in as little as 1 hour. They're absolutely fantastic at what they do. All you need to do is contact their 800 number on the number listed below in the bottom right, or you can email them. Again, this is at no cost to the members or your covered dependents. If you have any of those challenges, please feel free to reach out to the advocacy department. They're here for you, and they will work with you to get whatever challenges you have resolved. Next slide. So when to contact the insurance carrier versus when to contact our advocacy department. And I like to start with the carriers. Is if you need to order a new ID card, you can always do that on either the carrier's website, or you can contact their customer service number to reach out for a new ID card. If you're looking to change your primary care physician, you can also do this on the carrier sites as well. Or if you need help finding an in-network provider, if you look on both UHC and UMR on their sites to see if your doctor is in network, then you would want to go directly through the insurance carrier. You can also ask them about any questions if you receive a bill. However, if you are not getting the answers that you need, then you can contact our advocacy department. They'll work with you. They can reach out to the carriers on the back end, like I had mentioned before, to see what's going on with that bill. You can also ask about your plan designs, what your co-pays are, your co-insurance or your deductible. You can do this through the carriers, and they'll be more than happy to provide you with that information. And if you have any general questions about any coverage questions about your healthcare plan, you can always contact the carrier as well. When to contact our Viva advocacy. Again, if you have questions about a bill, you've already tried to contact the carrier, you weren't successful in finding out if that bill was covered, please contact our advocacy department. If you're having any challenges, like let's say getting a referral, or you're not able to get in contact with your doctor, or you're being denied coverage for whatever reason, please contact our Viva advocacy department. They'll be more than happy to work with the carrier, the medical groups, or the actual doctor's office that you're trying to get assistance with. If you have, again, questions about prescriptions as well, like I had mentioned in the example before, they're really good about finding out if your prescription is covered as well. So if you just reach out to them again at that 800 number, they're more than happy to assist you. Again, they are available Monday through Friday from 8 a.m. to 5 p.m. Next slide, please. Next, I would like to talk about Teledoc medical experts. I know that both Diana and Margie has talked about Teledoc as far as virtual visits go. Well, we actually have what's called, or we have a second opinion program, and this was actually formerly through Best Doctors, so you may have recognized them as Best Doctors, has now become Teledoc, but it's the exact same services. And what it is it's a second opinion program. Let's say you're about to have a surgery, or you get diagnosed with a condition and you would like to have a second opinion? Well, you can contact Teledoc. You and your covered dependents can contact Teledoc anytime. And what they will do is they will work with you on getting you that second opinion. With your permission, they will reach out to your doctor to have your medical records sent up. Once they're sent into Teledoc, they will reach out to world-renowned experts in the field of expertise of whatever it is that you guys are going through, whether it's, let's say knee surgery or hip surgery, or, God forbid, you have to work with cancer or anything like that. They can find a medical expert and take a look and see, your images, your labs, your x-rays, and see if you're getting that right diagnosis, that prognosis. They can even look to see if you're getting the correct treatment option. Is that surgery that you're about to get outdated? Is there a new surgery that would work better in this case? So they'll be able to give you that second opinion. I always like to tell folks, this is something that I hope that all of you will never ever need, but in case you do, it is there to assist you, and it is covered at 100%. So this is for you and your covered dependents. All you would need to do is contact the 800 number below. Moving on to our virtual Viva Resource Center. So we have a brick and mortar building in San Diego in Mission Valley, as well as we just opened up a second location that we're really excited about. It's not quite open yet, but we are hoping to do a grand opening here beginning in January of next year. However, we have been able to go virtual this last year due to the pandemic, and it's actually been incredibly successful because we've actually been able to reach out to more folks than ever. If you are interested in seeing what the Viva Resource Center has to offer as far as virtual classes, you can simply go to our website at vivaresourcecenter.com on the lower right. You would just take a look at the group classes that are available. Now, some of these group classes include yoga, meditation, strength and movement classes. They also have my personal favorite are healthy cooking demos. They are absolutely fantastic. They can actually take broccoli and somehow make it taste absolutely amazing. So there are so many classes to offer. We're currently offering over 300 classes a month, and there's just a wide variety of classes that are available to folks of all ages. So we've had kids classes where our youngest participant is as little as 2 years old to our oldest participant who are well into their 90s. So it really does offer a balance to everybody. And what I really like about it is that you can, there are, like, if you are doing a movement class or a yoga class, they have levels, they have different levels to what your comfort zone is. So for me personally, when I join a yoga class, I'm doing the very beginner class because I am terrible at yoga. However, we do have advanced classes. And again, we have financial classes, movement classes, and more. We do post this information on the Viva Resource Center, and then we also notify the county every month of the upcoming schedule for each month as well. Next slide, please. Now, if you are a Viva member, you and your covered dependents can get more personalized care with the access to our care navigators. Our care navigators are nurse practitioners, and they're here to really simply help you with your overall well-being. If you are having any well-being challenges, and some of those may include like stress management, family relationships, chronic disease management, or even financial stress, whatever it may be, they're here to help you with your overall well-being. We've noticed that in the healthcare system, a lot of times we're being treated the same, even though we're all completely different individuals. Well, then the nurse navigators, the care navigators, are going to work individually with you on whatever challenges that you have as an individual. They're going to help coach you with any well-being activities or classes that they can help you with. They will give you that one-on-one personalized care so that you can help, or so that you can get that care that you are looking for on an individual basis and really work with them on achieving your overall well-being. This service is available to all Viva members as well as their covered dependents. Next slide, please. We want to let you know that we are on social media and you can connect with us on either YouTube, Instagram, and or Facebook. My favorite is actually through our YouTube channel. If you miss any of those group classes where you would like to take a look and see, like let's say a healthy cooking demo that you may have missed, you can always go on to our YouTube channel and take a look at all the classes that are available and rewatch any classes that you've already participated in or catch up on any classes that you have missed. This is all the classes that are on our website through Viva Resource Center, so we do post them. But if you want updates on what's going on with the Viva Resource Center, then you can also check our Facebook at Viva Resource Center, as well as our Instagram account too. Next slide, please. So all of the member open enrollment support resources, like I said, you can contact our Viva Advocacy Monday through Friday at the 800 number or email them. They are available Monday through Friday, 8 a.m. to 5 p.m. As well as any of our benefit contacts, you can reach out to our carriers as well if you visit our vivaonline.com website. Next slide. That was all I had. Again, my name is Matt Ogden. I am your dedicated account manager for Viva, and want to thank also Diana Burke and Margie Gorham from both UnitedHealthcare and UMR. We really appreciate it. At this time, we would like to open it up to some questions that you may have. Please go ahead and type them into the Q&A, and we'll be more than happy to answer each question. And so we actually do have one question that has come in. It explains that my daughter is planning to move to Northern California in August of 2022 for college, and we're currently on the UnitedHealthcare Network 1 plan. Will she have coverage up north when she moves? So Dana, I'm going to have, I'll go ahead and address this, and if you can, go ahead and chime in as well. Please.
Yeah, absolutely.
Basically what would happen is we would need the location of where your daughter is going to be going to school. Once we do that, we can establish what plan she will be in. She'll either, if she's in California and she is in an HMO covered area, then she would be put onto the UHC full network plan. This would not be an additional cost. It would be the same cost as what you're currently paying in premium with the county. However, the out-of-pocket cost will be a little bit different at the time of service.
Exactly,
now,
Matt, you explained it perfectly.
Yes, and then if she is moving outside of a UnitedHealthcare covered area, then what we do is we put them on an out-of-area dependent PPO plan. And basically what this is again, you would still pay your normal premium. It would be at no additional cost. However, costs for services at the time when they visit, then it would be subject to what the out-of-pocket costs on the PPO plan would be. So really what you want to make sure to do is notify the county of when your dependent is going to be moving, and then they will go ahead and make sure that you get put onto the correct plan as, and this will be determined by the address of that dependent. Diana, did I miss anything, or would you like to add in on that?
No, you answered it perfectly. The only thing I would share is that this is something that Viva does specifically for their Viva members. So it's actually really incredible. It's quite the benefit. So like Matt said, it's at no additional cost to you premium wise. Rates just might vary, benefit and co-payment amounts just might vary dependent on where your child is. And what plan they end up, what network they end up accessing services through. But no, really well said, Matt.
Thank you so much. And as far as the corresponding prescription plan, like I said, it just depends on where the dependent is going to be moving, if they're going to be put onto the full network plan, or if they're going to be put onto the out-of-area PPO plan, depending on that dependent's address. Then we are able to provide benefit summaries, which goes over the out-of-pocket costs for each plan, including the prescriptions.
Perfect. It looks like there are some other questions that have come through. If you're traveling on vacation and on the Network 1 plan for UnitedHealthcare and you need to see a doctor, can you be covered by your insurance? yes, of course, you will be covered. However, you are only going to be covered for urgent or emergent care services while traveling out of network. So you can't just say, go to Arizona to visit a family member and then make an appointment with a PCP down there. And actually, while I'm addressing this question, the question of what is a PCP came up as well. A PCP is your primary care provider. So that is going to be your main physician who helps coordinate your care, gives you referrals to see specialists, and is your main kind of point of contact as a physician goes. And so I hope that that answered the question about the PCP. And then as far as if you are traveling, you're always covered by your insurance for UnitedHealthcare for urgent and emergent care services. However, I would strongly recommend if you're on vacation and you can do a virtual visit, that would likely be the easiest and most low cost option for you to be connected with a doctor and still get the care you need. All right, we had another question come in. If I'm enrolled on the UHC HMO Network 1 and I have a PCP, can I still use Teledoc? Yes, you may. You can use any of the 4 contracted provider groups. So there's Teledoc, Amwell, Optum Virtual Care, which is actually new this year, and then Doctor on Demand. All right, and then we have one other question, which says, what is the difference between Viba and UnitedHealthcare? So UnitedHealthcare is your actual health insurance. We are your health carrier, so to speak. And Viva actually is the benefit administrator.
Correct. Yes, we're the third-party administrator who provides those benefits to the county.
All right. Are you seeing any? Okay. Did you talk about what the premium cost would be for this CS Viva Alliance HMO monthly? No, I have not talked about any of the premium costs for any of our HMO options. If you have any questions about premium rates, I would suggest that you talk to your benefit administrators. Okay. Do any of the plans cover home birth? That is actually a question I've never been asked before, so I can look into that. I will stop sharing my screen just so I can look into that for you. And then Matt, I had a question. Are we automatically signed up with Viba no matter what plan you take? So yes, the answer would be Viva is your third-party benefit administrator. So you are very lucky that you are automatically a Viva member if you do choose to get health care through the county of San Diego. So not only do you either get UnitedHealthcare or Kaiser benefits, but you get or UMR benefits, excuse me, but you also get the very rich benefits and resources that Viva offers.
So just to add on to that as well, if you are a Viva member, as long as you enroll in a UnitedHealthcare plan or the UMR PPO plan. If you are on a Kaiser plan, then that is not administered under Viva.
Perfect. Teledoc phone number again, please. Do you have that?
And then how do you compare services to Kaiser? Well, Kaiser is a one-stop shop where all of your doctor's visits, your prescriptions, your images, your labs, if you're seeing a specialist, it's all done at a Kaiser facility. So everything is housed directly through Kaiser. With UnitedHealthcare, and maybe I'll let you speak a little bit more about this, Diana, but you have you have more of a selection when it comes to providers as far as medical groups that are affiliated with the plans. Do you want to touch base a little bit on that, Diana?
Yeah, I think you did a really great job explaining. So the one other thing that I would mention is that Kaiser, and Matt, I'm sorry if I missed you saying this. I was going through some of the other questions. The main difference too would be that Kaiser actually everything, as Matt said, was a one-stop shop. So they actually employ their doctors, their nurses, their medical staff. UnitedHealthcare does not. We actually have direct contracts with some of the most highly rated medical groups in different areas of the country. So for instance, we contract with Sharp, we contract with Scripps, we contract with UCSB. So the difference between UnitedHealthcare and Kaiser would be that you have obviously different provider options. and you have more flexibility in terms of who you go see. You're able to get second opinions outside of your medical group if you so choose to. We have some really incredible medical groups that are top of the line for clinical trials, or new procedures that they're trying out, some more experimental type of procedures, which can sometimes be really beneficial. It just truly depends on what you are looking for, I would say, from your healthcare. Okay, do I need a specialist referral every time I visit with that specialist? No, you do not. Typically, and it just depends on the medical group, but typically a referral is good for 1 year. So no, you would not have to be re-referred within that calendar year to go see a specialist 2 to 4 times. Honestly, the only thing I've ever seen happen with a referral is if you wait too long to schedule an appointment with that specialist, your referral can lapse. And then there were a couple of questions. Did the specialist copay go down from 40 to 25? I'm not sure which plan that was referring to. And then where is the Signature Value Alliance HMO? And then also the page flipped back before I took a picture of the previous page regarding copays. So I can go back through the deck if that's easier, just so we can make sure that we get everybody's, let's see here. All right. So I know there was a question about the alliance. Oopsie, sorry about that.
I think that's on your slide 8, Diana.
On slide 8.
Mm-hmm.
Okay, thank you.
Co-payment.
Thank you. Trying to be all tech savvy for everybody. Sorry, guys. Close your eyes. I know this is going fast. I want to make you motion sick. All right. There we go. Perfect. Okay, so here are the co-payments based on the HMO options. Network 1 is going to be at the top. Performance HMO Network 2 is in the middle, and then the Viva Alliance is down bottom. All right, so I'm going to just, if anybody needs to take a photo of that, go for it. And then I'm going to back up because we had a question on the alliance. So this is the alliance plan. The question just says, where is the Signature Value Alliance? So it's right here. It's still an option. We have UCSD, Scripps, and Rady Children's in network.
It was also asked if we will send a copy of the presentation. Yes, absolutely. I've already provided a copy to the benefits department through the county. So absolutely, we can share that presentation with you as well.
Thank you, Matt. Okay, it looks like we just got a question. Is the CS Viva Alliance the same as the Signature Value Alliance HMO? It is, except it's actually a customized Viva Alliance plan for Viva members. Which still has UCSD in network. So UCSD stayed in network for our Viva members, which is all you really need to know. Yes, it is the same, except you just have UCSD staying in network for the Viva members. Oh, I got another good question. Do you need a referral to see a chiropractor with the Signature Value Alliance? No, you actually do not need a referral to see a chiropractor on any of the UHC HMOs that self-refer. Let's see, what else is self-refer? An OBGYN visit is also self-refer. Sometimes dermatology can be self-refer. I think that's it. And then mental or behavioral health is also self-refer. And then other than that, you will need to get a referral from your primary care provider or your PCP.
Are there any additional questions? Let's see. Oh, Diana, can you please go back to look up how to look up chiropractors covered it by UHC? I think we have that
Absolutely.
for the Optum slide.
I do, yes. Here we go. All right, so the main thing you really want to make sure that you do is you take a photo of this slide so that you have the URL. It's a little tricky to write down just because of its length, but it's the www.myoptumhealthphysicalhealth.ca, the abbreviation for California.com. So once you go to that URL, you will be faced with the page on, or I should say with the screen kind of on the left-hand side. So you'll see from that drop-down menu circled in navy blue, you'll click on Provider Locator. Then it'll take you to the slide on, or excuse me, the section, I should say, the screen on the right. You'll want to just make sure that for specialty, you select Doctor of Chiropractic and that you fill out whatever information you choose. And then just make sure, most importantly, that under the plan and product drop-down, you select California Schools Viba to make sure that you're actually finding a chiropractor that is covered under the Viva network. I actually have used this site for my own personal chiropractic research, and it's been really wonderful. So highly recommend. Is acupuncture covered? No, it is not covered. Limits on visits for chiropractic. As long as medically necessary, it's unlimited.
Correct, yes. So acupuncture would be not covered.
Exactly. No acupuncture, but chiropractic is covered.
Are there any other questions regarding your Viva benefits or your medical plans?
Hi, everyone. This is Nidra. I'm hoping we got all the questions answered. It appears that we have, and I'm thinking this might be a wrap unless there are any other questions coming in. We'll give it a couple more minutes.
Yeah, Diana, they are
Yep.
asking if
Yes,
the doctor
they are.
recommends acupuncture due to sciatic nerve pain.
I mean, you would have to be referred to an acupuncturist, but because there are no acupuncturists in network, it's a really good question. I'm not sure how that would go. To my knowledge, no, it would not be covered. However, I suffer from sciatic nerve pain too, so I completely understand why you're asking that. I know how awful it can be. Typically, what they'll usually do for sciatica is they'll recommend PT first, and then if that still doesn't work, you can kind of try the more homeopathic option. But no, unfortunately, acupuncture is not covered under this plan. So you would likely want to find, if you were really interested in going to an acupuncturist, you would likely want to find somebody who you can pay out of pocket for that is not too costly. I know there are a couple in the San Diego area.
And again, if you do have questions about coverage or anything, you can always reach out to the Viva Advocacy Department as well that we had provided on a few of the slides too. They can assist you with any of those coverage questions.
And I'm just going to get that answer about the at-home birth being covered. Let me just try and check on that too.
Diana, for that birth question, are you going to answer it shortly here, or will you be sending an email to?
You know,
the
I
Advocacy
just
team?
pinged one of my colleagues just because I'm screen sharing, so I don't have the ability to check right now. Give me one more minute, and if he responds, I will let you know. Otherwise, I can easily follow up via email if that would be better.
Excellent. Okay.
Yeah, so don't worry, I'm working on it. I can easily, though, in the interest of time, we can absolutely end it if there are no more questions. I don't want to hold anybody in necessarily. Okay, so for an at-home birth, the answer is it would be subject to approval. And then, you know, there are some kind of nuances here, but it depends on if the person giving birth wanted a midwife and things of that nature. So I don't know if that answer is helpful at all, but if you have any more information that you'd be willing to provide, I think I could probably give you a better answer. I stopped sharing my screen just so I could get an answer to this.
Oh, excellent.
Okay.
Diana, there's an add-on to the from the individual and questioning.
Okay, perfect.
That,
okay, as a planned home birth with the midwife. Okay, great. Thank you for that info. So essentially what you would want to do if that's something that you're interested in, you're going to want to speak to your PCP about this. And then basically what they can do is then submit a referral to the medical group for midwife approval. So if you're with Scripps, do it through your PCP, and then they'll submit a referral through Scripps. Otherwise, Sharp, UCSD, same thing. So just depending on which network you're in. Just want to have that conversation with your PCP. You're welcome. And then two, I know that I had thrown this up during the presentation, but if there are any questions that are left unanswered after this presentation, we actually have a dedicated customer service team. And I believe I have the UMR customer service numbers on here as well. So let me just pull up that slide and then I can end by screen sharing with that. I would encourage you to take a photo if you have your phone handy, just so that if anything, like I said, if anything comes up, you know where to go. All right. Can you see my screen? Is that showing up?
yes.
Yes,
Okay.
you can see it.
Okay, good.
Okay, I believe this concludes the webinar. I thank everyone again for joining us. I think I speak on behalf of myself and our carriers, our presenters. Everyone have a great rest of the day.
Thank you so much.
Thank you,
Thank you all
everyone.
so much for